Listen to this data right now, 2024. We expect approximately 153,000 individuals to be diagnosed with colorectal cancer or colon cancer. From those, 50,000 are going to die from the disease. And listen to this, 19 to 20,000 are going to be individuals under 50 to be diagnosed. From those we expect from those to die somewhere around 3,500 to 4,000 people in a year, just in 1 year. So colon cancer, it's something that really, it's a big problem, and it's growing and growing and growing. And of course, there is a family component in colon cancer, but the most important factor is diet, low in fiber and very high in ultra processed foods. And I find it funny when people say that fiber is not important. When people say that, really, they have no clue on what they're talking about. When someone has colon cancer, it's because inflammation has been in the colon for a large period of time. It doesn't happen in a week. It happens after years. Picture this. You have all the tubes that go from any faucet in your house. That tube is made for water, soap, toothpaste, your saliva, normal stuff that should go down there. What happens if you start putting acids, hot oil, I don't know, something that is abrasive for the tube? It's going to be perforated. It's going to damage, of course. Same thing happens with our intestine. If we start getting all these things down our intestinal tube, do you think my intestine is made for this stuff? Do you think my intestine is made for the blue colorant, for the yellow colorant? Of course not. So the colon has different functions. Maybe the first thing that we need to remember about the colon is the absorption of water. And not just absorbing the water that you ingest, but also the water that we produce in tears, in all the fluids in the nose, in the mouth, all the saliva, all the things that we produce in the gallbladder, in the stomach. In our colon, we are reabsorbing about 12 liters of water in a day. We reabsorb water and we absorb electrolytes that are the two main things that we need to have good hydration. Also, the colon, in that process, and the first part is very fluid, but as it goes and absorbs and absorbs and absorbs and absorbs all the water, it starts dehydrating stools, so stools can have the right amount of water. We eliminate some water in the stools, but we eliminate the right amount of water. Also, when we talk about stools, the colon is necessary for the formation, for the storage, of course, because you don't go pooping all day long. No, we have storage of stools, but also for the propulsion of the stool. But also, we have all the microbiome or the microbiota, which is the right term, which is the balance in between bacteria, fungi, viruses, and parasites that we have throughout all of our body. But the colon, by square centimeter, it's a part of the body that has more amount and more diversity of all of this microbiome, of all of these microorganisms. How do we maintain it? With a diet rich in fiber and with good hydration, but especially a diet rich in fiber. How do we promote a diet rich in fiber? Very easy. Vegetables, fruits, things such as legumes, things such as nuts and seeds are absolutely high in fiber. Of course, remember to have an adequate amount of protein. We don't eat protein just because we need muscle. We ingest protein for the structure of all the body. And of course, the colon needs structure. Also, we need to remember that things like vitamin D, it's important for colon health. Things such as omega-3, it's absolutely beneficial for promoting a low inflammation in the intestine. But everything is not related with food. Of course, incorporating good amount of exercise, it's going to be necessary for the motility, for all the movement in the intestine, but not only cardiovascular exercise, but also resistance training has shown benefits from all the myokines, which are enzymes that have anti-inflammatory properties that might be beneficial for lowering inflammation and oxidative stress that might affect the colon. Also, remember that we need to have the right amount of use of fiber in our diet. People go and they go crazy going and buying the first fiber that they can get. Fiber, it's important. We need around a minimum 30 to 35 grams of fiber a day. But what people tend to forget is that when you go and you eat a very large amount of fiber, then you produce a lot of mucus and then you can get an intestinal tamponade. We don't need to take a lot of fiber. We don't need to have also a lack of fiber. We need to be taking the right amount of fiber. But this is not just about just doing exercise, just incorporating diet, just incorporating maybe fiber. We need to also go and check how is my digestion on a regular basis. How has my past, how has maybe actions that I've done in my past could be affecting right now my digestion. Things like what? Maybe you have taken antibiotics without having a good probiotic during and after the antibiotic that you took. If I take antibiotics and I don't take probiotics, just from the first dose, I'm going to have an altered microbiome, and that might lead to problems, of course. Also, if you have chronically used antacids such as omeprazole and suprazole or any of those, when we have chronic use more than 8 weeks, it has been shown how it can alter my microbiome. And remember that cancer is not something that appears just by doing one thing. It's something caused by multiple causes or multiple things done through large amount of time. Or people go and take a colon therapy in which they put a hose in the colon and then they put a lot of fluid and then they take it away, and people think that it's completely perfect because they did a colon cleanse. What they forget is when you take everything out, you might be altering also your microbiome, and this might lead to a lot of problems. And that we need to emphasize on the maintenance of sleep and managing stress. Why? Because we have a gut-brain axis. And the gut-brain axis tells us how from my gut I can alter my brain, and also from my brain how can I alter my gut. Let's remember that the gut, all the GI tract, it doesn't work by Wi-Fi. It has a wire, like this computer has a wire to the wall, to the outlet, and then it goes to all the rest of the wiring. The intestine has a wiring that's part of the parasympathetic nervous system through a nerve called the vagus nerve. This is very important. If we are stressed, if we don't sleep, this nerve that goes from my brain into all of my GI tract is going to disconnect, is going to not work properly. And we can start having a lot of conditions, gastritis, reflux, a lot of problems. And also we can start having problems in our colon. And this might lead with all the other things. You can start maybe ingesting more alcohol, having a poor diet, and all these things might lead, of course, to cancer. What's the best thing that we can do for cancer right now? The best two things that we can do is prevention and early diagnosis. On a regular basis, if you don't have anyone in your family with colon cancer, people starting from age 40 to 45, depending on which guides do you read, but starting from 45 with a colonoscopy and then performing it also if you have something in your family from 1 to 3 to 5 to 10 years, depending on what we find in that colonoscopy. As age goes by, some people recommend doing it more frequently, but again, please go and talk to your physician. But also remember that the best thing that we can do is prevention on a daily basis, but also having a good diagnosis. This is a very safe procedure by bringing all of these tools into my lifestyle, to have a healthy lifestyle, to have optimal health, not only for my colon, but for the rest of my body. And also, two, if you're over 45, go and actively talk to your physician so we can do something about your colon. We can do an early diagnosis, or we can just be checking up and knowing that there's nothing going on, that there's no polyp going on there, and we can be treating it if you have something, or just doing a right diagnosis at the right time. That's the best thing that we can do in order to prevent all the data that I mentioned at the beginning of this video. And please remember that the best way that we can keep on building this community together is by sharing the video. Also, don't forget to like the video, and also subscribe. Remember that when you subscribe, it's not by getting more followers. It's to know that when you subscribe and when you hit the bell, you are going to be notified that we made a new video. Why is this important? When you get more knowledge, when you get more tools, then you can keep being the owner of your health, which is the only purpose that I have as a physician, and that's my compromise with you. Thank you guys, and I'll see you next time.